Welcome, colleagues. Good morning, good afternoon, good evening. Welcome, everybody. We're going to give a minute or so for all participants to join. Welcome from wherever you're joining us. We have quite a large group joining today, so we're going to give it a couple of minutes before we start the webinar. Thank you for joining us. In the meantime, if you want to share who you are, which organization you're working from, you can do this in the chat. You're welcome to do this. Welcome, everyone. Thank you for joining us. We're just going to give it a minute or so. Please do introduce yourself in the chat. Thank you, Tatiana. Let us know where you're joining from. Thank you for joining us. Good morning, good afternoon, good evening. Welcome. I think we're going to start. Welcome, everybody. I'm Florence Martin. I'm the Executive Director of Better Care Network. It's my pleasure to welcome you to this 15th webinar on the Transforming Children's Care Collaborative. Today's webinar is going to be focused on breaking the cycle, mental health and well-being for care experienced children, young people and adults. And we will be hearing the learning, the experience and expertise from Uganda. It's our pleasure to welcome you today. I'm going to do a little bit of housekeeping. First of all, making sure that we have, you're in the right language channel. We have Spanish interpretation for this webinar. So please go to the bottom of your screen, choose the interpretation button and make sure you're in the right channel for the language, either Spanish or English. And you should be able to hear properly. Next slide. So as mentioned, this webinar is hosted by the Transforming Children's Care Global Collaborative. If you're not familiar with the collaborative, it establishes strategic sector-wide collaboration from global to local levels on strengthening children's care and care system. If you're not a member and you want to join, we will have the link in the chat. And you're very welcome to join the collaborative and any of its groups and task force. Now, as mentioned, do please introduce yourself in the chat. Make sure you select everyone when you send a message so everybody can see it. Just to let you know that the webinar is being recorded and that the recording will be made available both in English and in Spanish as well. So a reminder again, if you've just joined, do please select the interpretation channel. Make sure that you're selecting either English or Spanish so you can hear us properly. Welcome. We are going to have the Q&A box, which you can also see on your screen, and that is going to be used if you have questions or answers. So please, if you have questions or comments, use the Q&A. Don't use the chat. The chat is for introducing yourself, but it's better and easier to use the Q&A for the questions and comments. And as well, if you want to upvote a comment. So welcome. It's my pleasure now to introduce our moderator. Next slide, thank you. Fiona Bisu is an advocate, an ambassador for Uganda Care Leavers and also Child's Eye Foundation. She's an advocate on... Why did you have to tell them to move? Oops, do please mute yourself if you're not If you are not already muted, make sure that you are. So Fiona Pisu is an ambassador for Uganda Care and the Child's Eye Foundation. She's also a Crown Miss Uganda 2012. She's an advocate and collaborates to create impact on a whole range of projects relating to young people, including care leavers, teenage mothers, a range of government initiatives in Uganda. And Fiona, it's a real pleasure to have you here today moderating this webinar. So over to you.
Hi, everyone. I'm delighted to welcome you all to today's webinar on a very important topic. And this initiative has been at the forefront of addressing the critical issue of integrated mental health and well-being support for our youth, with a special focus on young people who have lived in care. So today, we're honored to have distinguished presenters with us who are going to provide us with great insights on this groundbreaking project. Without further ado, I would like to introduce our presenter, David. And David is a dedicated social work professional with over 15 years of experience in child protection and safeguarding. He has a passion for making a positive impact in the lives of vulnerable children. He brings a wealth of experience and knowledge to his role as the country director at Child's Eye Foundation. David's commitment to child welfare and advocacy is clearly evident in his daily work, where he strives to create a brighter future for those in need. As a valued member of the organization, David plays a vital role in advancing the organization's vision and mission in ensuring that every child has a chance to thrive and flourish. So over to you, David.
Okay, thank you, Fiona, for that introduction. So my piece is very simple. I'm introducing Breaking the Cycle, and would want to know what is Breaking the Cycle. Well, this is a youth-led, accessible video series accompanied by a guidebook, and it's focused on identifying, addressing, and supporting the healing journey for children, young people, and youth in Uganda experiencing well-being and mental health adversity. One thing that we know is mental health problems affect 10 to 20% of children and young people. And many of these individuals reside in low and middle income countries. Evidence says that these lifelong risk factors are associated with institutionalization, including violence, abuse, and neglect. The goal for this innovation of breaking the cycle is to provide families, social workers, and youth-led organizations, including students, with the initiative to initiate important non-judgmental conversations about mental health and well-being. We know this is a very touchy subject, and along with it sometimes comes a lot of stigma in trying to address the challenges that we face in the communities. This toolkit addresses several areas, looking at trauma and stress, depression and suicidal ideations, anxiety, as well as dealing with loss and grief. These we know are issues that our young people face in the communities, and most especially our young people who have grown up in care. Next slide. So this project that was implemented was supported by Grand Challenges Canada, as well as UBS Optimus Foundation. We implemented this in 5 districts across Uganda, representing both the urban, peri-urban, and the rural settings that we work in. It was implemented in partnership with Uganda Care Leavers, also known as the Association of Care Leavers Uganda, Makerere University, who was our research partner, and No Limit Generation, who did our video production and handled our content. The purpose of this innovation was to demonstrate community-led, integrated mental health approaches and mechanisms for young people in Uganda. And this was actually led by youth with lived care experience, those who have grown up in orphanages, and was also a way for them to be able to advocate, to provide a platform for them to speak on their own behalf. Next slide. So what was done during this project? I'll give just a few pointers. We were able to bring together a network of 117 youth who have grown up in care. And these had been placed in communities within the last 5 years. So these youth were trained as peer mentors and well-being champions using this innovation of Breaking the Cycle toolkit. We also used the innovation to train 80 social work practitioners and youth serving professionals. These are both government and non-government, to support the children and the young people whom they serve. We also were able to create well-being groups that was consisted of the young people, youth-led organizations within the districts, as well as government practitioners. Our peer support network was created by our youth well-being champions. Each of the 117 youth was able to create a peer network of 10 youth within their communities. So this was a model that started with 117, but scaled up to being able to support 1,170 youth within their communities. Next slide. What did we learn about this approach? We definitely learned that many of the young people who have grown up in care have experienced trauma that affects them on an individual level, talking about affecting their self, affecting others whom they interact with, their beliefs, and the way they actually view the world. One thing that was very special about this project and innovation was that it was developed with direct input from young people. This toolkit that we're talking about today, that you're going to learn about today, was actually peer-led and developed by the young people who participated in this project. And I just want to finish with this and say that the peer-led approach is definitely sustainable and is more effective than using other approaches. I want to thank you for listening to me as we introduce this project. Back to you, Fiona.
Thank you, David. As you can see, it's clear that this initiative holds immense promise in addressing the mental health and well-being needs of our youth, especially those who have lived in care. So it has been an insightful overview of the Youth Wellbeing Project. Now, we have a remarkable young person with us today. She's going to be sharing the incredible impact that she has made, having been driven by a deep, deep sense of purpose. Brenda is a resilient advocate and mental health well-being champion based in Jinja. She draws her inspiration from her challenging upbringing in the care system. I can relate. Her creative approach, it utilizes the arts to promote self-expression and healing. She offers a beacon of strength in her community. So Brenda's journey, it exemplifies the potential for positive change. And this is emphasizing that one's past does not define their ability to inspire transformation. So Brenda, over to you.
Thank you, everyone. Hope everyone is doing great. Yes, I'm one of the well-being champion and with the care experience. Yeah, I live in Ginger. Thanks so much, Fiona. Uh, when I got out of the institution, it was really challenging. I didn't like it. Yeah, here I see here the exciting part and the challenging part. 70% was challenging and 30% was exciting. We'll start with that 30%, which is the exciting side that I got over of the other torture. I know I had left it because where I was, it wasn't nice. Like, really, I missed my family. I missed the parental guidance. I missed that pampering love because that was really cruel and too much of hardship. The challenging part, I lost identity first of all. I lost friends in the community. I didn't know what to do because most of the things were turned for me. So when I left, I had nowhere to start from. It was like they had promised me a journey. Then in between the journey, I was dropped on the way. I can't go back. I can't continue. I got confused. So I didn't
Okay.
reach my destination. On the other part, I was like, how am I going to start school? I had no money. And when I returned home, the reason was like they were forcing me to do what I don't like. For example, I wanted to be a doctor and they're forcing me to go for tailoring and I know nothing about
Okay,
it.
okay, Brenda, I would like to
Yes,
ask you some questions in relation to what you just shared. So I understand the transition from life in an orphanage to living with family can be both exciting and challenging.
yes.
So you started to tell us about how it was like when you left the institution. So would like you to further elaborate briefly. How has life been since you came back home with your family? And how it has been like being a well-being champion in your community.
Okay.
Mm,
Yeah, with my family, uh, I came back to them and I was united to them. Uh, I got where I belong. And as a well-being champion, at first it wasn't okay with me, but when I joined the mental health program and I learned a lot of things because I was traumatized, I was stressed out, I had no hope for the future. I felt like killing myself, suicidal thought. I had a lot of it. But when I came here like to learn about the breaking the cycle mental health, I knew there was someone there in the gap for me because I think I was really missing someone to talk to me about my trauma and the stressing part and the overwhelming responsibility I'd taken. Yeah, again, the
okay.
positive,
Speaking
again, the
of
positive.
having nobody, sorry, speaking of somebody having nobody to talk to and that trauma, so you have instead started to show that to people. So how have you supported other youth in your community? I mean, what are you doing to support, fellow young people who have experienced this trauma and they've also had nobody to talk to? But then thank you that Brenda, you're there. So how are you going about this?
Yeah, when I gained the confidence about myself and I knew I have a future after being talked to, I met the 10 people in the community. I talked to them, I was like, because I also made them in the same situation where I used to be like. And when I talked to them, like, you still have the future, I had to talk to them about self awareness, to know who they are, to know that they have better future still ahead of them. And making a group of 10, we used to reach like each of them and we help them with homework. We created a club where everyone comes in. Those who feel like they can't do anything, we make them get involved in that club. We have the drama group, sports. So I make them get
Mhm.
involved so that they don't think of the past too much. They keep their mind active and ever saturated with other words. And we created the saving group, which some are using like to do their business. Like I personally, I'm doing some grocery business out of that. Yeah.
Oh, yeah. On that note, your business. So I want to know, what are you looking forward to in life? I mean, the viewers would like to know after having gone through all that, and then you're still reaching out to people and helping them through that trauma. So, as Brenda, what are you looking forward to in life?
Um, I'm looking forward like to see everyone is happy still I'm looking forward to achieve my dream because I'm still insisting and I'm persisting to achieve it. And I'm looking forward to see that you have a group where we can have more care experience student or children to join, and they also have a happy life with other support. Thank
Wow,
you.
thank you so much, Brenda. I know from personal experience, it's not easy to share your trauma and still want to help people overcome or deal with their trauma. So I would like to applaud you for that. And thank you for joining us today. I appreciate
You're
that.
welcome. Thank you.
Yes. And to our audience, if you have any questions, please feel free to submit your queries in the chat. Yes, we'll attend to them momentarily. And once again, I thank you for being here, and let's continue supporting the well-being of our young people who have lived in the care system. And now, as we embark on this video series, we have the opportunity to gain a deeper understanding of the challenges our young people face and the vital role, I beg your pardon, that integrated mental health support plays in our lives. In this series, we will hear from experts in the field, educated professionals, and most importantly, the young people who have navigated these challenges firsthand. Our stories, insights, and experiences will shed light on the complex issues of trauma and stress and how these can be effectively addressed through learning from programs like the Youth Wellbeing Project.
Many young people are suffering. We've noticed that when children grow up in orphanages, there's a lot of trauma that goes on there. And when they come out, they are faced with so many mental challenges.
I'm already dumped, I've been wounded, I have nothing, I don't have any hope. Because they encouraged me, they gave me that hope. But amidst this, I lost everything.
Most of your time you have spent it on the street, you have no home. And now the place where we could call home, we have got mistreatment.
I was tortured mentally, physically.
Trauma is caused by several factors, and many of these are related to the experiences that they have had in life.
Some of the common symptoms of PTSD include hyperarousal. Someone is very vigilant. They have intrusive thoughts, and that is very disturbing for them. They have numbing and avoidance. Then negative thoughts and mood changes.
A person or an individual that is traumatized and is not supported to pull out of this trauma, to be able to form these relationships, may in the end find themselves more isolated and just always, blaming themselves and thinking, I think it's my fault, I think it's my fault. And I think that's why we even begin to hear about someone telling you that I think I should take my life, it's just too much for me. And when someone starts to tell you, I think I should take my life, it's a big, big, big problem.
Coping with the effects of trauma can feel difficult and sometimes endless, but there are lots of things that could help.
Stress can be managed in different ways. Healthy ways include knowing your triggers, what sets you off, what brings about your stress.
If you're very stressed, you need to rest. If you need to, give yourself a break, it is very important to give yourself a break so that you can just maintain your good mental health in order to help others.
These vulnerable children can find some sense of belonging, sense of being, sense of who they are.
That sense of belonging is where these people, all these children, have to be with some parents or guardians whom they think that they can feel free to express themselves to them.
The moment you feel you cannot express yourself and be yourself as a child, I feel that is that is really dangerous to your mental state.
When a child is well defined, when they know who they are, there is no challenge that will defeat them. So it is very important that we equip them with the skills to enable them survive out there and live a meaningful life. There are 3 stages of trauma recovery. The first one is safety and stabilization. Stage 2 is remembrance. It involves working through the trauma. Then we have stage 3, reconnecting and integration. Much as these people have been traumatized, they may not forget what happened immediately, but they also need to get back into the community. They need to be reintegrated.
Despite what these children face through their childhood, it's very much possible that they can thrive through a supportive environment that realizes their potential and builds on it. These children can thrive well.
And life was a bit challenging when I was coming out of the orphanage because you are always in the fear of the unknown.
When we transition these children and young people into the communities, into the families, we need to work to ensure that the support systems are in place, the structures are in place to support these people when they transition. That way we can ensure that the long-term support is available and it evolves and adapts in line with the changing needs of the young people who have been transitioned.
The most thing we can do is that we can support the communities to educate them to know how they can keep these children.
It shouldn't be good to be in orphanages. It is better for someone to grow up in a family.
I think if you were to stay with our parents, it would be even far better.
They should be fully supported like any other child who is in a normal home setting.
My friends, my sisters, my brothers, they are really supportive still. They still comfort me.
The community welcomed me because of that vision, of sharing with them the little. They welcomed me. And I have friends who said, however much you went through those, we are with you.
I have big dreams about the young people of Uganda.
The most important thing this child needs from you is love.
I want to believe that there are families out there that would want to take on these children, and that would give them the best foundation for belonging.
People can take up foster roles. You can become a foster parent to some of these children. It will actually help to build these children in an all-around way.
Ever since Child Diary settled me, I have been able to know myself. I have been able to explore myself and what I can do, and that's what I do best.
So we have several other series that shed light on the aspect of mental health and youth well-being. So you feel free to visit the links that we have shared on the chat. And this is just a reminder, this video series can be used by all, from social workers, government officials, civil society organizations, and even individuals if you want to better understand what this championing we're doing is about. Now, I feel like there's no better way to understand mental health if not from the perspective of a psychologist. Ladies and gentlemen, we are joined by an esteemed psychologist who has played a pivotal role in the implementation of our youth well-being project. With over 28 years of experience, Miss Atim Grace is a seasoned counseling psychologist. She holds a master's degree in counseling psychology, a bachelor's degree in the same field, a diploma in social work. She specializes in supporting vulnerable communities from orphans to street kids, children, adolescents, even addicts, and of course, not leaving out the women. So, ladies and gentlemen, let's share with Miss Grace Atim.
Hello, everyone. Good evening, good morning, good afternoon to all of you all. Like you've heard, my name is Atim Grace. I am a counseling psychologist. It's a great honor to be part of this team. Next slide, please. So I just want to give you a brief background of what this is all about. What is the background of this program, Breaking the Cycle? It's very clear there is evidence of over 8 years of research that indicates that children growing up in institutions has a negative impact on their well-being. Research findings consistently highlight that growing up in an institution has a detrimental effect or detrimental effects on children who grow up there, especially their development. Children thrive in a family setting, and an institution can never replace a family. And as such, there is a growing global consensus to promote family-based care as opposed to institutional care. Child Eye Foundation strongly believes and advocates for every child to be brought up in a family setting through family-based support care approach. Next slide, please. Child's Eye Foundation has championed the family-based care approach in Uganda. Through working with government to strengthen the services that respond to families' needs through identifying and working with grassroots organizations, training community volunteers and other. Just give me a minute, I have an issue here. Can't see my whole slide. Training communities and volunteers to work with families that are taking on these children. Children with no family go back to alternative or foster care within their communities of origin. Child's Eye Foundation works with orphanages to repurpose them into hubs that could be turned into training centers, schools, or anything that could support these young people. Next slide, please. It's against this background that Breaking the Cycle was conceived. It was against this background that a gap was realized by Child's Eye Foundation, and a team of partners set out to address the issues that were manifesting amongst the caregivers, especially when they left the orphanages. Children living care are faced with several challenges to include developmental delays, stagnation, both cognitively and physically. They are stigmatized when they get into society. They have mental issues. These children have attachment and belonging issues, like you've heard from our young people. They have self-esteem and identity crises. They also have issues integrating and transitioning challenges, fitting into the community, because these children have been in a closed-off community now, going into the open can be very challenging for them. They have emotional and behavior challenges. Because their emotions have not been fully explored, when they get out there, they tend to be very challenged and they don't know how to respond to the challenges that they are faced with. They have impaired social skills. You imagine growing up locked up and then you're put out into an open community and you don't know how to behave. So socially, they are challenged. They lack or they have, they're given skills that are duplicated. And next slide, please. So with these duplicated life skills, they tend to find difficulties finding employment. Now, what is Breaking the Cycle training program about? Just like the title says, the program was aimed at breaking the cycle of the effects of institutional care among the caregivers. The primary beneficiaries of this program were a team of selected caregivers from 5 districts in Uganda. David elaborated about that. Secondary beneficiaries included a selected team of social workers in practice and those who had just graduated, as well as community members, community leaders at various levels, including community volunteers. While caregivers were faced with a wide range of challenges, Child's Eye Foundation and its partners chose an area that was very critical to address, and that was mental well-being. Mental well-being, broadly as a crisis intervention strategy, its emphasis was put on areas the research indicated as very critical. Next slide, please. And these critical areas were, we just picked out 5. They had other issues, but these were the most critical. One of the critical areas was stigma. Like I mentioned, when these kids went into community, they were stigmatized, they had mental issues. Another issue was stress and trauma. They were overly stressed and most of them suffered, they were suffering from post-traumatic stress disorder, which was affecting their functionality. The other that was very common amongst them was depression, suicidal thoughts, and suicidal tendencies. I think we heard from one of our caregivers indicate that they had that. Many of them had anxiety. Then we also had issues of grief and loss. Normally, I'll just elaborate a little bit here. Leaving the institutional care and going into transitioning into families was challenging for them, and this brought about the cases of grief and loss. Now, when dealing with these issues, we had to adopt a trauma-informed approach that focused at empowering and facilitating individuals to explore in depth what happened to them, unlike what happened to them, unlike the approach that says what is wrong with you. Now, this approach is empathetic in nature, non-judgmental, and it helps individuals, broken as they may be, to explore issues in a safe environment, thus empowering them. Next slide, please. What are some of the problems that were presented while we were working with these young people? You'll notice that we are just giving you highlights. We won't go in depth. Now, some of the problems that these young people faced included difficulty fitting in with family, because the dynamics in the home and the dynamics at home in the institution and the dynamics in the family were different. So it was difficult for them to fit in. Some of them presented, actually most of them presented with psychological abuse from relatives, plus also abuse from the institutions where they had come from. We were also encountered with unemployment because they are treated with suspicion. Maybe I'll just give a brief about this. Children who come from institutions, because they behave differently, many people look at them with suspicion. Many people don't appreciate them. So they tend to find it very difficult to find employment because people will look at them as strangers. Loss of property because young people had no experience living alone, let alone how to survive outside the orphanage. Again, let me elaborate on this. These young people, when they are in the institutions, they are locked up. They are basically conditioned. Lights out, time to eat, the bell goes, time to eat. So at the end of the day, these children do not have what we would call the common survival skills. Children were let out and given housing and told to go and survive. A child doesn't know they have to lock the door. A child doesn't know they have to look after their property. So this caused a lot of problems to most of these young people. Several cases of suicidal thoughts and a few attempted cases of suicide. Suicidal thoughts were very common. The reason being that many of them didn't have a sense of being. They didn't understand why whatever was happening to them was happening. And when they thought they knew who they were when they were in the institutions, and when they stepped out, they have to redefine themselves again. So that took away sense of a meaning of life. Anxiety, definitely anxiety was very common amongst them. What is next? What will happen to me? Many of them were very depressed. There was stigmatization from the community, family, but also self-stigmatization because they didn't understand themselves and they didn't understand what was happening to them. We had issues of behavior, especially from complaints from families. Children had weird behaviors. They had social conduct issues, which communities found unacceptable. So this also caused a challenge to these young people. Next slide, please. So more of the problems that we encountered, majority of the caregivers suffered from post-traumatic stress disorder. Some of them had prolonged grief. We had many issues of identity crises. Some of these young people, when they went into communities, because, like I said, they were not fully accepted by some of the community members. They were exploited. Some were actually abused, both physically. We had a few of attempted sexual abuse. Lack of basic skills, both social and survival skills. I mean, a child doesn't know how to wash their clothes. A child, I call them children, even though some of them qualified as adults, could not do basic things for themselves, like wash their clothes, cook for themselves, yet they had been sent out to start living alone. So they didn't have the basic skills. Like I've already mentioned, sexual abuse and other forms of physical abuse. We also encountered cognitive stagnation, helplessness, and dependency. Now, cognitive stagnation, you find that a child an adult who is 18 years still thinks like a 14-year-old child. Now, that was a big setback for most of them. And that was, in a way, held them back in fitting into community, because in a home setting, someone expected an 18-year to behave like an 18-year, but an 18-year was very dependent, very helpless, couldn't do anything for themselves. So this affected them. There was also lack of proper identification documents. This we found with some of the young people who left homes and couldn't find their families. So in the country, we all are supposed to have a national ID. So some of these young people didn't have these national IDs, which are a requirement for them to get a job anywhere or employment of any kind, or even now enrolling into school. So these were some of the problems we encountered. Next slide, please. What were the outcomes and the benefits of the training? I think our young people have attested to what happened when they went through this program. The program had a profound impact on the young caregivers, helping them gain insight into what was happening in their day-to-day lives, being able to identify and interpret feelings, process them, and develop coping strategies that were practical within their means. Among other things, caregivers were able to gain an understanding of the importance of their mental well-being. They were able to draw up strategies of how they could support each other. I think Brenda made mention of that. They acquired skills on how to manage their emotions. They were able to identify and know what support systems they had within their communities. Many recognized that they suffered from post-traumatic stress disorder. While it was addressed, a big number sought personal counseling, which was a very good indicator. Both social workers and community leaders were moved and by the training and asked that the training be extended because mental health issues were not just faced by caregivers. So this was also a good indicator for us. Next slide, please. It was also evidence that after the initial training, some of the young caregivers were able to recognize themselves and were living a much more meaningful life after the training. Family relations improved due to better communication and understanding. A small number were thriving in their careers or businesses. Majority were more optimistic about life. Next slide, please. So what are our recommendations given what the outcomes were? While working with the young caregivers, it was evidence that a big number had mental stagnation due to limited exposure and stimulation. Thus, caregivers need a comprehensive training and challenging to prepare them to go out and start another life. When I say they need challenging, I think some of the homes that we said have to be repurposed, should be used to train caregivers in such areas as life skills, that is supposed to be starting life outside an orphanage, importance of health and mental health, because why do I mention this? Children had issues of hygiene. Some young people, caregivers had issues of self-hygiene. So it is very important that they get training in these areas. It's also important they get survival skills, self-care, and maintenance skills or independent living. They also need knowledge about their cultures, language, practices, taboo before they are taken out into the community. In most African cultures, it is not okay for us to wear short clothes. So, or to have most of our body exposed. So young people faced a lot of challenges. And this was one of the reasons why communities actually were rejecting them. It was like, they're so uncultured. How do they dress like that? So I think we need to prepare them in these areas, have them know a bit of their languages, know the taboos, know something about their culture, and then take them back into the community. Provide education and support, vocational training and job placement. Why? Because I said earlier that they find difficulty finding jobs. Family and communities have contributed to stigmatization and it's a part I can't see. And stagnation. Fiona, can you help me there? Just a moment.
Where are we?
I'm having, okay, just a moment. Okay, family and communities have contributed to the stigmatization of these stigmatization of these caregivers, meaning that before children are reintegrated, families and communities need to be well prepared and trained. I know it is done, but they come up with strategies on how it is. Let the family and the communities come up with strategies on how to support these children who are coming home. Child acceptance is not automatic in families, because when these children were sent to orphanages, there was a reason. So, and for the relationship between family and their children to grow, there needs time, and the time differs. You can't give it a specific time. So this needs a lot of attention. Family need continuous psychosocial support to harmonize the reintegration of children and family, or reunification of family and the children. Economic empowerment, which is more sustainable, may be needed for families instead of handouts. What am I saying here? Let's help families start up income generating activities that will help them maintain their family without getting outside support. Follow-up is very critical. When children are reintegrated, majority have attachment and trust issues. Hence, they need a consistency or presence of someone they know to have healthy attachment and trust, because some have gone to the street as a result of failing to have a healthy relationship with their families, or have ended up being maltreated because they're perceived as disobedient or bad-mannered children. So it is very important that follow-ups continue. That could take like about 2 years, because building a relationship can take quite a while. Continuous mental health support and input for both caregivers and family is critical. Excuse me. It's important to note that it's not only family only the caregiver that has been traumatized. Families have been traumatized too by having them separated from their children. So it's very important that they both have continuous support in relation to mental health. Next slide, please. In conclusion, family can never be replaced by any other. There is no such thing as a perfect family, but family is where our roots are. When you grow up as a child from a family, when you grow up outside a family or in an orphanage or in an institution, you're cheated of belonging, identity, and everything perfect or imperfect about a family. Our endeavors should strive to empower caregivers, develop essential skills that will enable them live a healthy life and thrive throughout life. Thank you very much for listening. I hope it has given you insight.
Well, ladies and gentlemen, I hope you're all as inspired as I am by the incredible work that we have just heard in the presentation and how the project greatly impacted the lives of young people and will continue to do so. So we're going to proceed with our discussion, keeping in mind the importance of integrated mental health and well-being support for youth, especially those who have lived in care. But before we go to that, I would like us to take a moment to acknowledge Ms. Susan Ajok. She was part of the video series on breaking the cycle. Ms. Susan Ajok unfortunately passed away last year. She was the country director of Child's Eye Foundation. And her contributions, insights, and dedication to the topics that we discussed today still leave a lasting impact on all of us, as she was a valued member of this organization and a great contributor to the toolkit and the projects, because Susan was greatly dedicated to supporting young people to achieve and thrive and grow. So in memory of Susan Ajok, I would like us to take a moment to honor her and reflect on the positive influence that she had on our community. Just give it 2 seconds to breathe. Amen. Now, ladies and gentlemen, we're also privileged to have and hear from Sumaya. Sumaya Nasuna is a dedicated social worker with a bachelor's degree in social works and social administration. Her personal journey and experiences have fueled her passion for championing mental health and well-being, particularly for individuals that are transitioning out of care. With an unwavering commitment, Sumaya brings a unique perspective and a strong desire to make a meaningful impact on the lives of others. Take it away, Sumaya.
Thank you so much, Fiona, and everyone for joining. As she has said, my name is Sumaya, and Sumaya Nasuna, and I'm a social worker by profession and also a caregiver who spent almost 13 years in care. Of course, as we know, being in care is a closed system, does not allow you to interact with the outside world and makes you susceptible and vulnerable to many mental health challenges. I, for one, personally, I was suffering from depression, finding a sense of belonging, and having attachment issues. And when I was brought on board when I was introduced to this mental well-being session, I was able to get to know about different mental health issues, for example, depression, the different signs that it manifests itself, and how the different triggers, and how to go about them as a person. So,
okay.
Thank you so much.
Thank you. All right. And so you'll just give us a brief about your experience was growing up in an institution, and then go ahead and tell us how the youth wellbeing training improved your knowledge and awareness on mental health.
Yes, from experience, we were not allowed to go out and relate. So I found it hard to socialize and getting friends. And sometimes when I used to get friends, I found it very clingy. I found myself very clingy to this one person, and I wouldn't want to share them with another person. So being able to be part of this mental health awareness program, it enabled me to know more about myself and how I behave around people. So it made me to know what triggered this, what causes this dependence syndrome, and how best I can maneuver through this. So it made me more self-aware about myself and how I can relate with others as a person and also as a profession as a social worker. Thank
So
you.
is that how the training has helped you cope with trauma?
Yes, I have gained power, and I know I'm in a better mental position right now. I'm in grip of my emotions. Yes, I can't say I'm there 100%, but I'm trying. I'm trying, really.
Okay, yes, it's as long as you're trying.
Yes.
So how has this informed your daily work as a social worker, influencing your approach to supporting vulnerable youth in the community?
Thank you so much, Fiona. And as we know, social work is a profession that is nested around relationships with people. So if you haven't settled down your emotions or your demons per se, you're going to end up transferring them on others. So as a professional, and being trained on trauma-informed approaches, it made me aware that some of our clients or the people who work within the community may undergo traumas or have undergone traumas, and we should not victimize them. Instead of asking them what happened to you, like instead of asking them what is wrong with you, you can gladly, as a professional, ask them what happened to you. Be more empathetic and non-judgmental and create that open space where they can express themselves without being victimized. Thank you so much.
Yeah, I always say be kind or be quiet, and you lose nothing from showing kindness to the person next to you. So would just like you to give some advice to caregivers, even youth, on how to better support, young people leaving the care system. If you could give us some advice, what could that be?
One of the advice I can give is these young people are really incredible and they are really unique. So we need to be kind. Of course, mental health challenges do not manifest themselves physically. So we need to be kind because we don't know what other people may be living in. Because as you see me, I may be very bubbly, but deep down inside, I may not be well. So let's be kind and support young people with lived experience to be better. Thank you.
Yes. Thank you so much, Sumaya, for sharing that. And having been a caregiver myself, one of the things I faced was victimization, and Miss Grace has explained it. So thank you for that advice. I can relate to it and I fully support it. Be kind. So thank you so much again for sharing your valuable insights, and your journey and experience. Truly, truly inspiring. I would just say, hongera, don't stop.
Thank you, everyone. Thank you.
Okay, ladies and gentlemen, we will now dive into the transformative findings of this well-being project. We have the privilege of hearing from Dr. Laban. Dr. Musinguzi is a professional social worker and lecturer at Makerere University with a PhD from the University of Amsterdam. With over 17 years of experience in academia and research, he specializes in community health, gender-based violence, and children's studies. He employs a mix of qualitative and quantitative methods. His extensive publication record and consultancy work span from the government to NGOs, UN agency, and the private sector as well. So, without further ado, I welcome Dr. Laban to share the invaluable insights of the Youth Wellbeing Project. Hello, Doctor.
Thank you, Fiona. I want to confirm that you can hear me very well, because then
Yes.
everybody should be
Yes.
able to hear me if you can hear me. And thank you so much for kind introduction. I'm not very sure I'm all that you've mentioned, but I take it rest. Thank you so much. So in the next to reflect a study that we did on the same project that you have been hearing about, which is community-based youth peer-led mental health and well-being support project. So we usually call it well-being support project. And I think, as David earlier on mentioned, we were the sort of the research arm, the research team that really supported the project to document any improvements, any okay, I hope my video is on. Yes, so if it's not on, well and good, you can hear me. So I was saying that we are part of the research team that really supported the project to document the experiences, the transformations, and try to bring out the evidence that this community-led integrated peer-supported project actually works. And as we all know, and of course, like the previous speakers have mentioned, mental health is a big issue, not only in Uganda, but actually globally. Next slide, please. And of course, we know really that, all the evidence, that have been put across, that we've read in the literature, they all point to the increase in mental health challenges. But at the same time, we don't see services. We don't see really services that are commensurate to the burden of mental health. You hardly find any policies that guide mental health interventions or services. And so this whole landscape, while we have so many people that get affected, different categories, the old, the young, again, evidence suggests that youth in institutional care are actually most vulnerable, to mental health issues. And yet, there are no services, but also because of the issues that we have already had, issues of neglect, issues of abuse, issues of trauma, suicidal thoughts, suicidal tendencies. So the issues that affect young people in institutional care are extremely greater. And therefore, in response, the next slide, please, in response to these issues, as my colleagues already mentioned, with funding from Global Challenges Canada, Child's Eye Foundation and the Uganda Caregivers Network implemented this beautiful 15 months pilot. I call it a pilot, and I'm sure this is proper. Really sort of to try to utilize an innovative model, an innovative approach that focuses on prevention, but also promotion of mental health, and specifically looking at young people with lived experiences of care. As David already reminded us, there was lots of things that were done, supervised peer support, providing safe spaces for young people to speak about their mental health issues, to explore issues of trauma that have affected them, supporting skills development, talking about their challenges. All these things were done as part of this intervention. Of course, as already David mentioned. Next, please. And of course, again, like we've seen already, as you can see, we have a network already, but this network really was established as a youth-led, learning partnership between young people with lived experiences of care and social workers. Specifically, we trained final year social work students from Makerere University, and they were really providing the support. And also the intention was, that at the end of the day, we'll be able to provide a peer network, to establish a peer network of well-being champions. And like, David mentioned again, the 5 districts of Uganda that, include Masaka and many others. Next, please. So the intervention ultimately, focused, and I'm going to present the results on these 3 main outcomes. One is that there was, really a need and intention to make sure that there's improvement in knowledge and understanding of, trauma-informed approach. Something that actually Grace already talked about. How do social workers understand? So there was a need to actually increase, to sort of create mental health literacy among social workers. And also to make sure that youth receiving this support would demonstrate, sort of clinically meaningful improvement in their mental health, their well-being, their self-esteem, their self-worth, issues around depression, and all these issues that actually Grace talked about earlier. And also to, ensure that, the champions, the well-being champions would demonstrate improvement in knowledge of mental health literacy, resilience, and psychosocial support. Next, please. So for us, when we came in as the research team, as we already mentioned, our purpose was really simple: to generate evidence around the effectiveness of this pilot. To what extent can we say that if you establish a community-led, a peer-led, a youth-led, in a resource-constrained setting with very limited input in financial terms, to what extent can that be effective? Next. So we came in, we did this pilot study. We looked at, all the different categories of people that David already talked about: the social workers, the champions, and also the community youth, who are basically the peers of these champions. So we did what you'd call a pre-post. So we basically used a basic methodology that would help us to quickly capture the issues around any changes that could have been brought in by this particular project. And of course, like mentioned, we followed the young people who started or who are enrolled in the project or in the pilot intervention at the beginning of the intervention, and then we also followed them at the end of the intervention. Next, please. We used standard tools in our assessment. They seem quite many, but each of these tools actually assesses a particular component or a particular aspect when it comes to mental health and mental well-being. So we had the Kirkpatrick's evaluation model, and this was really intended to assess the effectiveness of the training programs, the training kits, the manuals that were developed, and the issues that these people were trained in. And then also we did the patient health questionnaire, which really, we call it the PAQ9, that looks at depression. We also used the standard WHO 5, which are basically 5 questions, sets of questions that looks at mental health well-being. And also the locus of control scale, which also looks at the extent to which somebody has, the ability to control things or events around them. And then the self-esteem scale by Rosenberg. Next, please. Next. So in terms of results, again, I'm giving you really a snapshot of these issues. We found that actually knowledge of the social workers that had participated in the trauma-informed approach trainings to address mental health needs for young people, improved across all the areas that were measured, that were trained in. But of course, as you can see, there was some improvement in some areas greater than others, but overall, the picture shows that actually these sort of worked and improved the knowledge of the social workers and their understanding about trauma-informed approach in addressing mental health issues. For instance, when you look at, the social workers whose knowledge on what to do for trauma recovery, about 65.5% really had this awareness knowledge, comprehensive knowledge before the intervention, before the training. And we see this actually going to 76.4% after the training. So this really shows that within the shortest time, the training was able to to increase knowledge. Next. And then the other key area where we also assessed is the youth who are able to demonstrate some clinically meaningful improvements in mental health and well-being, depression symptoms within the last 15 months of the intervention. And we use the locus of control scale, which basically assesses the individual's perception about the underlying, sort of main causes of events in their lives. So if you score highly on the internal locus of control, it means that you actually have everything or have most of the events under your control. But if your score is, in the external score, it should be really low if we have to show this. So in our results, when we subjected this scale or assessment on the young people with lived experiences of care who had gone through this intervention, we found that actually there was a huge improvement, quite significant, that at baseline, 29.4% of young people said they had, there was this perception that the events, in their life, they were really under control of their lives. But this really increased substantially to 72.8% after the exposure to the intervention. So this really shows a huge sort of leap in terms of how this intervention was able to improve their perception of how they can actually take charge of their lives. And of course, as we've had these stories from Sumaya, from Brenda, these are quite phenomenal things, and probably also what Grace was recommending earlier on, trainings and making sure that we support these people. Next, please. Again, when we looked at the well-being index using the WHO 5, the tool I already mentioned earlier, which really categorizes well-being in terms of worst, poor, and best, in terms of the scores. Again, we also see really significant improvement between the baseline and endline. For example, at baseline, more than half of the young people with lived experiences of care, posted what you call the worst, well-being index. So 57.6%. And after the baseline, after the intervention at endline, we see this also, jumping again, looking to more than half again of these young people posting beta or best on the well-being index. Continue. Next slide. In terms of those that show depression symptoms severity, as I already mentioned, measured by the PAQ-9, that categorizes severity of symptoms as minimal, mild, moderate, moderate severe, and severe. We found, some improvement, particularly among those who posted minimal depression, from about 26.1% to 40.2%. So not so good, but again, there is really improvement that actually with just simple intervention, you are talking to people, you're exposing them to information, even depression can actually be addressed. So, and as you can see, the interpretation of these results is that quite a number of people, of the young people with experiences of care, may not necessarily need depression treatment, which was not the case before the exposure to the intervention. Because before the intervention, we see quite a lot of the young people with experiences of care actually posting results that required depression treatment. But of course, there is still need, as we can see, that there's quite a number of young people that even after exposure to the intervention, there is still need for treatment for depression using antidepressants, psychotherapy, or a combination of these. So again, probably this also suggests that there is still need to, continue and probably scale up and make it even more intense, and also make it long term, because you can imagine 15 months, this was really a short time. Continue, the next slide. And then in terms of self-esteem, again, Grace talked about self-esteem issues among these young people with lived experiences of care, which is a big challenge. So using the Rosenberg self-esteem scale, which also measures esteem as low, normal, and high, we realized that actually the intervention had an effect on the young people with lived experiences of care. At baseline, for example, about 13.0%, or 13% basically, their self-esteem was really low. If you know what low self-esteem really does to a person, you understand what this means. That, really, really low. But again, this, sort of improved from 13 to about 5.4%, which is quite also commendable. And of course, you can also see the young people who posted self-esteem measure as high also increased from 9.8% to 14%. And of course, again, as we finalize the write-up, there are also quite a lot of beautiful dynamics that we are teasing out currently from the data, that actually there are also differences by gender, for instance, that there are also differences by where the person actually stays, and a few other dynamics which we are working on. Next. And then in terms of the young people who are demonstrating improvement in mental health literacy, people who know, for example, what causes trauma. You heard earlier on Sumaya talk about the fact that she became aware about some of the things that was really happening in her life. So this sort of awareness, about mental health, basically what we call mental health literacy among the young people with the experiences of care. Also, we see some improvement as a result of the intervention, almost across all measures or knowledge areas, including trauma, understanding of what causes trauma or how to manage trauma, what triggers PTSD, like Grace already mentioned. All these knowledge areas actually posted significant improvement, and that also shows that the project had some bit of change. Next. So what does this mean? Just giving you this snapshot, sort of, in my language, we would call it oclosa. Oclosa means that, you test something. So we have given you a test now. What does this really test mean? That we really see that even with little exposure to information, using videos, using all materials, guidebooks, and some of these actually were developed by young people, like David already mentioned. The intervention demonstrated potential. We really feel this might revolutionize mental health services, or how we deliver, how we provide, and actually how we understand mental health issues or services in resource-limited settings. You don't need to have billions of shillings or billions of dollars to actually put an intervention that can actually work. Because as you can see, almost all indicators are showing, improvement. And also because it's possible then, we can learn that it's possible to create awareness and skills about mental health, enhance mental well-being, and ultimately improve the quality of life of people, by focusing on what we call problem-solving interventions. Interventions that are peer-led, interventions that are community-based, interventions that are homegrown, that are home-supported. What we call home solutions. Next. And lastly, therefore, we feel that it's extremely important. It is our informed opinion that a project of this nature, as sort of a proof of concept, as we normally call it, proof of concept, that really we have seen this works. I don't know if there's anybody who still has doubts about this. If you still have doubts, we shall share with you the report and look at the incredible findings, the way the intervention, the pilot, just 15 months, have actually sort of provided potential on how to revolutionize mental health services in poor resource settings. Thank you so much. Asante sana. Thank you for listening. And thank you, Child's Eye Foundation and partners, for the opportunity. Makerere University, we are excited.
Thank you, Dr. Laban, for your outstanding presentation. And I hope we all found this as enlightening and thought-provoking as I did, because you all know that to address and effectively deal with such a critical issue, extensive research is highly encouraged. So hopefully this can, help you think deeper about this project. Thank you so much for participating, and I'm still encouraging you to keep sending in your thoughts, your questions, your queries. Let's chat. Let's understand this well-being project better, and we know how to further implement and help young people. So now it's time for our Q&A session. Like I said, please feel free. This is a judgment-free zone. We have our presenters here, and they'll provide more insights and they'll address your queries. Okay? Now, I would like to also address our gratitude to our esteemed panelists and speakers who have shared their valuable insights and experiences. And of course, my champions, the young caregivers. We appreciate your dedication and expertise in this tremendous cause. Now, let's hear from you. We want to address your questions, concerns, and thoughts on this critical subject. This session is an opportunity for you to engage in a meaningful dialogue and explore the nuances in this integrated mental health and well-being support initiative for the youth. Now, to ask a question, please type in the chat, and then I'll deal with it with the panelists and the whole team. Our panelists are ready. So also, you can feel free if you want to specifically ask someone on the panel. We had Brenda, Sumaya, Ms. Grace team, Dr. Laban, David. Please ask. Please ask. All input is valuable. Okay. The first question I see here, it's for Ms. Mai. What were the specific challenges or obstacles that were faced during the implementation of the project, and how were they addressed?
Thank you, Fiona, and thank you everyone for joining us on this call. So we had quite a few challenges, but because of time, I'm going to just mention two. We all know that during the implementation of this program, we had COVID-19 lockdown. So we really had struggles with moving from one place to another. But how we dealt with this was mapping service providers in the districts where the program was taking place, and also partnering with other institutions in the area. The other challenge was the stigma on mental health. So many young people didn't want to be involved because of the the word mental health, we all know the carriages. When someone mentions mental health, they think you are either bewitched or you have some evil spirits disturbing you. So most of the young people were like, you are now insulting us, you're calling us mentally ill, you know? So, but that's actually how we started changing the name from mental health to mental well-being and to breaking the cycle. Yeah, another thing is reopening of the schools. Most of the young people had to go back to school. That means others moved to different districts where the program was not implemented. Other youth in the community also had to go back to school, but how we dealt with that was to ask the young people to, or the well-being champions to continue making groups within their schools, and also to encourage those who moved out of the district who are implementing the project team to reach out either to Grace or the Child's Eye staff if they needed help. Thank you so much, Fiona. Back to you.
Okay, and I have some questions here in the Q&A column. Anonymous attendee is saying, what are the specific challenges or obstacles faced during the implementation of the project and how were they addressed? Now, Mai has just shared with us what happened and what they did. Okay, another question is, how sustainable is the peer-led network approach, especially in training well-being champion? I will pass this over to our panelists and they can answer this.
Okay, I'm happy to take that on with support from the group as well. So the peer-led network means this is a well-being champion actually supporting other youth within their community. So these other youth are their neighbor, their neighbor's neighbor, you know, people within the village and the area that they stay in. So this is very sustainable in a way that you're not going to spend a lot of resources in terms of bringing your community together to have sessions. The Breaking the Cycle Toolkit can actually be trained in phases, maybe have 2 hours in one day to be able to go through one of the sessions. And we've heard that this can actually bring back some bad memories and people can actually break down during these sessions. And that is something that we've seen with everyone who has been a part of this process. So it's better to take this at a pace that everyone is comfortable with, in a safe place, and in a place where you actually may not even need money to actually sit down, maybe a community place which is free for the community members to come and meet. So we found that it was very sustainable in terms of also resources, in terms of also time, because these are people within the community that the peer champion, the well-being champion was staying in. So I hope that is very clear.
Okay, thank you so much, David. So if these questions that you're sharing, we greatly appreciate, but remember, we're going to share emails and the links and the videos, and you have all this information, and you will continue. As you continue reaching out, we will continue responding, and we should work together, you know. And then I see here Anonymous is also asking a bit about ethical considerations and practices working with young people who have gone through very difficult conditions while doing a research. Dr. Laban, if you're still there, I think you would answer this better.
Oh yes, but I don't know why my video off.
Briefly. It's okay. It's okay. We hear you.
Great. Yeah. So it's quite interesting. Quite an interesting question. One, beyond the ethical clearance approvals that we received from the local ethics committees and the Uganda National Council for Science and Technology, in the process of conducting research, we found that there were also other issues, that really ethical issues, like David just mentioned. Some, of the young people would really express suicidal thoughts. They really feel they are so traumatized, they want to kill themselves. So what we did was we had a well laid out protocol that had all these procedures of managing ethical issues that would come up. So, for example, case conferencing, I remember in some of the cases we would document them and have them handled by Child's Eye Foundation. And then, of course, Child's Eye Foundations would also link up with probation and social welfare officers to make sure that actually in the process of doing research, we don't even create more harm, because the more people begin to talk about their experiences, the more they actually feel, the experiences seem to come afresh, and they might really break down, and we really experience this. But there were really well laid down protocols that were put in place.
Thank you so much, Dr. Laben. And briefly from Gracer team, if you could give us one specific story of transformation or positive change that resulted from this intervention, and how can we make conversations of mental health more known to the communities in order to avert mental breakdown? I request you to be brief and precise. We're over time.
Thank you very much, Fiona. Names preserved because of ethical issues. Yeah. There was this young lady who sounded hopeless, felt like, she had no reason to go on. And as we speak now, I know she has picked up her pieces. She's doing very well. She's very enterprising. There are so many cases I could cite out, but one thing I must say, I am very proud of these young people because they have taken their life back. They did not allow to be defeated by their experiences. So in brief, that is it.
Thank you so much. Now, ladies and gentlemen, like I said, if you want to continue getting more information and sharing with us, we're going to share the contacts, we're going to share the email address, we're going to share the slides that were used today, because like we said, even the videos, it's for everybody to use. We're here to impact the lives of young people, especially us who have been through the care leavers system. So I would like to invite Miss Florence to join us.
Hi, Fiona.
Yes.
Thank you. And thank you so much, first of all, to you, Fiona, for your moderation, and to the incredible panelists, and also to our audience for staying patient with us as we ran a little bit over time. But I think it was definitely worth this extra time. We're particularly grateful for all the expertise, for also the learning and the lessons from everyone. And as we have shared with you, as we've said before, we will be sharing with you the recording from the webinar, also the resources and the links we're sharing in the chat, and as well an email so you can contact the Breaking the Cycle team if you have further questions. So we're extremely grateful to our panelists, to our experts, and to the audience. If we've also shared the link with the Transforming Children's Care Collaborative. If you're not already a member and you want to find out more, please connect and join the community. Thank you all, and we look forward to continuing this conversation. Many thanks.
Goodbye, everybody. God bless you.
Thank you. Bye.